My name is Nicole Smith-Holt, and I live in Richfield, Minnesota. I'm the mother of Alex Smith, who passed away in 2017 from rationing his insulin. The thing I missed most about him was his hugs. He gave the world's best hugs. Alec was, he was the comedian of the family for sure. He was the prankster. He was always pulling practical jokes on people. He thrived to see people laugh and smile and have a good time. He was diagnosed just 2 years before he passed away. He was diagnosed with type 1 diabetes. And a lot of people, when they get that diagnosis, it can be life-altering. To him, it was just another obstacle, another challenge, and he met it head on. 2017 hit, and it was just, I had this fear in the back of my mind. It's like, what is going to happen when this boy ages off of my health insurance? So me and him sat down and we started on the website for the marketplace. We were just putting in, information that was similar to him, just to see kind of what he could expect. Since again, even as manager, the restaurant did not provide any benefits. And what we were finding on the marketplace just blew my mind. I'm like, how do people who, are struggling, economically, or, just barely making ends meet, how do they afford what is on this marketplace? But what we found was, with his income and being a single person, no dependents, with his salary, he'd be looking at about $450 a month for insurance, which, is doable. I mean, it's a lot, but then the deductible was like over $7,500. He said, that's ridiculous. Doesn't make sense. Why not use that insurance money and just pay for my insulin at the pharmacy? So in May of 2017, he turned 26. We got the notice that he was officially off of my insurance. June, he went to the pharmacy for the very first time to pick up his supplies and get his insulin. And from the receipt of no sale that I found in his car, he left that day because they asked him to pay $1,300. And he didn't have $1,300. My thought is, he must have thought that he could, stretch what little bit he had left to last a payday. Unfortunately, when you do something like that, it's like playing Russian roulette. A type 1 diabetic needs insulin multiple times a day, based upon what they're eating, and he lost the game of roulette. It's just unbelievable that in the world that we live in the United States, and you think that things like that maybe happen in third world countries, or things like that, but you don't think about the fact that here in the United States, people are actually rationing medication. They're rationing healthcare in general. If they're not rationing that, then they're rationing, food. I became an advocate after losing Alec, for, access to affordable insulin for all. And all of the research and the studies that are conducted show that 1 in 3 type 1 diabetics have rationed. And, the risk, the complications that come from doing that are so severe. It's something that it should not be happening. So through my advocacy, we've created the Alex Smith Emergency Insulin Act in Minnesota. The last I heard, the program has served, close to 2,000 people in Minnesota lives. It's 2,000 lives that have been saved because we've created this bill. The governor and lieutenant governor were basically essential in the passing of Alec's bill. Like, we had faced so many roadblocks, and each and every time Peggy and Tim were both like, no, we're not ending this session. We're going to create a special session so that we can get this bill passed. Like, this is important. This saves lives, and this needs to pass. I have worked with Angie Craig. I have worked with Tina Smith, Amy Klobuchar, Peggy. For me to support Peggy is kind of a no-brainer. She's been a huge ally in Minnesota. She's just a real person. Like, she is somebody that I can call up and I can say, hey, I'm having this issue, and she can totally empathize. She understands what people in Minnesota are needing right now. And I think Peggy has a true grasp on things like that. I've not had those same conversations, or there's the same ideas or conversations with Angie. Healthcare is a human right, and we need to look at it as a human right and not a socialist issue. But we all deserve the right to affordable healthcare. We all deserve the right to affordable prescription medications.